Okay, this is chapter 4. We're going to be talking about psychopharmacology. When you read chapter 4, you probably noticed that we've already covered some topics in there, so this lecture is just going to cover the new topics. Some important terms. Psychopharmacology examines the effects of drugs on the nervous system and behavior. Drug effects are changes that are observed in physiological processes and behavior as the result of a drug. Sites of action are points where drug molecules interact with body molecules. And pharmacokinetics is the process of drug absorption, which is how it gets into the bloodstream, distribution throughout the body, metabolism or breakdown, and excretion or elimination from the body. There are a lot of things that influence the effect a drug has on someone. Most obviously, the pharmacological properties of the drug. We're not going to talk about those in detail right now because we're going to do that for each individual drug when we get to it. By definition, basically, psychoactive drugs or their metabolites have to be able to cross the blood-brain barrier in order to exert a psychoactive effect. Dosage, so the amount that someone takes of a drug. If we're looking at a drug that we're trying to have some sort of therapeutic effect, we usually try to precisely monitor or create the dosage so that it stays within a therapeutic window, which this is showing, so that it's enough that it's above a therapeutic threshold so that it has some sort of effect, but not so much that it's at a toxic level. Setting, or the environment in which the drug is taken. The route of administration, how it gets into the body, various individual factors, and expectations. So we're going to talk about the last three here in more detail now. So there are a few different ways a drug can get into the body. One of the most common, if not the most common, is oral administration. And so this is when you take a drug orally, you swallow a pill or drink something. The drug goes through your stomach and intestines, and it's absorbed into the bloodstream, mostly through your intestines, although alcohol does start to be absorbed in the stomach a little bit. One of the pros about this method of administration is that it's very easy. It doesn't take skill to administer a drug orally. You have a safety factor in that poisonous substances usually do not taste good. So, for example, none of you probably crave the flavor of Clorox bleach. Vomiting can occur to keep you from ingesting more or to get rid of some of the substance if it's toxic. This is what happens with alcohol. And it has a longer absorption time, so if someone takes too much of something, you can interfere. So you can pump someone's stomach, for example. It doesn't get directly into the bloodstream right away. It takes a while. Some problems with oral administration is that some drugs react with stomach acid and then lose their efficacy because of that. Or they have to be lipid soluble to pass from the intestine into the blood. So insulin, for example, cannot be administered orally for these reasons. Instead, it needs to be injected. After drugs go through the GI tract, they then go to the liver before getting through general circulation enough to get to the brain. And so they go through a metabolism there, which can break down the drug and make it less active. So drugs have to be able to survive stomach acid. They need to be lipid soluble, and they have to pass metabolism through the liver in order to have an impact. So only some drugs can be taken this way. Additionally, the food in the digestive tract influences how great of an effect a drug has on someone because it influences how quickly it's absorbed into the bloodstream. So that can make oral administration at times a little less predictable for what dose people are actually getting in the bloodstream. And the fact that it's a slow absorption time can also be a negative if you want a rapid response to a drug. You can also administer drugs by having them absorb through the skin or through certain membranes. So transdermal absorption is when you have a drug absorbed through a skin. This is usually done with a patch, like a nicotine patch or a birth control patch. There are even fentanyl patches, which is a strong opioid, which should only be given to someone that has a terminal illness and is in a lot of pain. A big pro of these is that they have a very steady release pattern. But not many drugs can actually be administered this way. The other type of absorption is through various membranes in the body, and these are basically intranasal, mouth, rectal, or vaginal membranes. With this, you don't have any injections, you don't have any difficult to swallow pills. It's a pretty fast absorption because all of these areas have a lot of blood vessels, so they pass really easily. The drug passes very easily into the bloodstream from these. However, these are less pleasant, so intranasal is like snorting, and that can damage your mucous membranes over time. The mouth membranes are probably not considered as unpleasant, but only some drugs can be administered this way. So chewing tobacco or drugs that are under the tongue, those would be mouth membranes. And then most people are not as excited about the idea of administering drugs rectally or vaginally. So another type is inhalation. This is smoking essentially, or breathing in certain vapors. And so with inhalation, the drug is absorbed from capillaries in the lungs, and this is actually the fastest method of administration to get something into the brain. So it can arrive at the brain in 5 to 8 seconds. This is administered usually either by burning a drug and breathing the smoke in, or by inhaling vapors that are traveling through the air. Because you're basically putting this straight into the lungs, it then just has to go through one side of the heart to get to the brain, so it's extremely rapid. However, you frequently will irritate the lungs, so you'll have respiratory distress, you might irritate the throat and lungs, and you can increase the risk of or exacerbate asthma, emphysema, and cancer. So when you think about smoking cigarettes, especially, or smoking pot, these are all issues that people can have when using this inhalation method. And then there's injection. So you can inject directly into a vein. That's IV, intravenous administration. So this is rapid. This is the quickest way to get a drug into the bloodstream, but not the quickest way to the brain. Drugs that are inhaled get to the brain a little faster than drugs that are injected, because when they're injected, they have to go through the heart and lungs and heart again, whereas with inhalation, you're starting in the heart. You have the most precise dosage control with an intravenous injection because you're controlling exactly how much you put into the veins. However, doing an IV injection requires skill, so it might not be appropriate in all situations. It's irreversible. Once the drug's in the blood, it's in the blood. You can't take it out. You might be able to administer an antagonist to reduce the impact of the drug, but it's already there. And repeated administration can cause collapsed veins and blood clots. Intramuscular injections are directly into the muscle. It's a slower absorption than IV administration, but it also can be done much more rapidly with much less skill. So an EpiPen, for example, is usually into the muscle. A lot of vaccines are delivered into a muscle, for example. Subcutaneous is below the skin. Of the injection administrations, this is the slowest absorption time, but it has a very steady absorption rate, which is nice. But you can only administer a small amount of the drug at once. All injection methods carry the risk of infection from dirty needles if the needles are not sterile or clean. And so all injection methods could lead to the spread of things like HIV, hepatitis, things that are spread by contaminated blood. So that's how drugs get into the body. To get to the brain, they then have to enter from the bloodstream. One of the things that influences how quickly they get into the brain is lipid solubility. So in order to pass through the cells that are lining the central nervous system, they need to be more lipid soluble. And if they're more lipid soluble, they're going to get into the brain more quickly. That's the main difference between heroin and morphine, is that heroin gets into the brain more quickly because it's significantly more lipid soluble. And so it is involved in a larger rush. The biggest difference then between heroin and Imodium, for example, is that Imodium, which is an antidiarrheal medication, does not cross the blood-brain barrier. After they're administered and they pass in the central nervous system, they're eventually deactivated by enzymes. This occurs primarily in the liver, but can occur in the blood as well, and then they're excreted. And this figure over here was just looking at the different methods of administration for cocaine and looking at the concentration in the blood, so not necessarily the brain. So you can see intravenous gets into the blood quickly and has the highest spike. Smoked is probably next, followed by, this is smoked, followed by intranasal, which is the most common for cocaine, and then oral. So drugs are then eliminated. Biotransformation is also called metabolism, but it's when the structure of a drug is changed into forms that are easily excreted and metabolites are produced. Metabolites are byproducts of biotransformation, and they are then excreted usually through the kidneys or the intestine. The rate of biotransformation, that's how quickly a drug is eliminated or broken down. For most drugs, the concentration of the drug in the blood has an impact on the rate of biotransformation. So that if there's more drug in the body, it's broken down more quickly. Alcohol is an exception to this rule, and that the same amount of alcohol is broken down at a very steady state. So having more alcohol in your system doesn't mean you break it down faster. It's just going to take longer overall. The presence of other drugs can also influence the rate of biotransformation. And when we think about the rate of biotransformation for different drugs, we frequently talk about the elimination half-life. And so that's how long it takes for 50% of the concentration of the drug to be excreted from your body. And so drugs with a longer half-life are going to have an effect for longer, usually, and are going to remain in the body for longer. So many drugs have fairly short half-lives of a couple hours, but Valium, for example, has a half-life of up to 48 hours, which can be 2 days. So it can take a long time for the effects of those drugs to wear off. Alcohol, again, the reason that we can easily have alcohol charts about how long it takes someone's body to process alcohol is because it's doing that at a specific rate, that's not dependent on the amount in the system. There are a number of individual factors that can influence how much of an impact a drug has on someone. One is genetics. Some people just have genes that result in either a higher, faster, or slower rate of metabolism. Another is race. So a number of Asians have very low concentrations of chemicals that break down alcohol, and so people talk about an Asian flush, where sometimes Asians have a more redness in their face because it's taking longer for their body to break down alcohol. Weight, so people that weigh more tend to be less sensitive to the effects of drugs because there's a smaller portion of their overall body size. Gender, there are a number of drugs that impact women more than men. So part of it's body weight, since women tend to weigh less, but part of it is just related to chemical properties. So women tend to have lower concentrations of alcohol dehydrogenase, which breaks down alcohol, so they're more impacted. And then age. Children are more sensitive to drugs, partially because they're smaller and partially because they don't necessarily have all the enzymes they need to break things down. And then as people get older, the elderly can be more impacted by drugs as well. You also have other drugs that are in the system influencing the impact of drugs. So you can have interactions that are additive. And so just plain additive is if you take one pill of Aleve and one pill of Tylenol, it might just be like taking 2 pills of one of the other, where you're just adding the exact amount on top of each other. You can also have synergism, which is called hyperadditive, which means the 2 drugs play off of each other and cause more of an effect than if you just added 2 of the same thing. So together they create something that increases their overall potency. You can also have potentiation, which is you need 2 drugs in order for one to have an impact, because somehow one drug primes or prepares the body for the other drug. And then you can have antagonistic effects, where a drug will decrease the impact of another drug. So expectations also influence the impact of a drug, and this is most easily demonstrated with the placebo effect. So placebo is an inert substance. It has no physiological effect, but an individual is generally informed that it does have an active impact. The placebo effect, because people think it has an effect, it tends to have an effect. The placebo effect is when an inactive substance has an impact, and is most pronounced for pain, depression, and alcohol consumption, where you can give someone non-alcoholic drinks and tell them it's alcoholic, and up to a certain point they may act intoxicated. So there are a number of causes of the placebo effect. One is expectancy. If you expect something to work, it probably will. And they've seen all sorts of factors can influence the likelihood of the placebo effect related to expectancy. So if a doctor seems more confident, if a doctor seems more caring and warm, then the treatment, even if it's a placebo, is more likely to work. Classical conditioning. So some is the associations people have with taking medications and getting better or feeling less pain. And then there are also physiological changes that occur. For example, with placebo-induced analgesia, we actually see that there's an increase in endogenous opioid activity. So that people are given a pill that they're told will reduce their pain. It's a placebo pill, but their pain is reduced because they have more endogenous opioids released, which actually does reduce pain. Because of the placebo effect, any drugs that make it to the market, like pharmaceuticals, have to show in a double-blind test that they're more effective than a placebo. So if a new antidepressant drug is being created, then the manufacturers have to show that when half of the sample was given a placebo and half was given the new drug, the people that were given the new drug actually got better than the people who got the placebo, and that the participants and the people evaluating the depression didn't know which group they were in. That's a double-blind procedure. So if trials are not able to show that, then a drug doesn't make it to the market. So it has to be more effective than the placebo effect, because usually the people in the placebo group will also show some improvement in depressive symptoms. So we talked about tolerance previously, right? This is a decreased sensitivity to a drug. After repeated administrations, it takes more of the drug to achieve the same effect. And we talked it was a shift of the dose response curve to the right. Tolerance can basically occur because of two mechanisms. One is metabolic tolerance, and so this is when the drug is being metabolized more quickly. And so, for example, alcohol is being broken down by alcohol dehydrogenase more quickly. So less of the drug is actually getting to the site of action. The other is cellular tolerance, and this is when there is a reduced response to the drug at a cellular level. So this is frequently due to downregulation of receptors. And so this chart, which you can see in your book too, shows here's a terminal button. There's the synaptic vesicles filled with neurotransmitters. When the action potential arrives, the synaptic vesicle fuses with the membrane. The neurotransmitters are released into the synapse, and they would bind to the receptors on the postsynaptic membrane. Okay, and so it's using this as an example of a normal synapse. After repeated exposure to a drug that influences these neurotransmitters, the number of receptors expressed on the postsynaptic membrane can decrease. We call that downregulation. So there's going to be less of an impact because there's fewer receptors. You can also have the opposite happen, where if there's not much activity, you can get upregulation, so you have more receptors. But cellular tolerance frequently will involve downregulation of receptors. Cross tolerance is interesting. It's when you could be potentially tolerant to a drug that you've never had if it operates by the same mechanism of action as another drug. So different hallucinogens can show, like LSD and psilocybin can show some cross tolerance with each other because they have similar mechanisms of action. So I have a video here for you to illustrate this.
It was normal as could be. Less normal was his capacity for drink. Andre's drinking is the stuff of legend. Most of the stories, the times he drank over 100 beers at a sitting, the occasions on which he imbibed multiple bottles of blended whiskey before dinner, several bottles of wine with dinner, and then cognac for dessert, are hard to substantiate because his drinking partners were seldom conscious at the finish.
It's amazing the amount of capacity that Andre had for beverages. He was a fine connoisseur of wine, but when the good wine wasn't available, Andre would drink any wine or beer. Andre with a beer can in his hand, you didn't know what he was drinking because you couldn't see it. It would be like you holding a thimble. I took his ring and I had a silver dollar, and I passed the silver dollar right through the ring. That's how big his fingers were.
Even when he was drinking, Andre was the designated driver.
When we were partying, it was better not to compete with him or try to keep up with him because his friends would end up sick, whereas he would always end up fine.
He traveled to England to perform in the movie The Princess Bride. He played a character very close to himself, Fetzik, the gentle giant. The movie was very popular, and Andre received praise for his performance.
Andre loved doing the movie. Never really spoke a lot about it, but I knew inside that it was one of the great things that he did in his lifetime.
During his time in England, Andre's back pain increased to the point where he decided to undergo surgery to relieve the stress on his back. To facilitate the surgery, an oversized operating table and special tools had to be constructed. Perhaps the most apprehensive participant in the surgery was not Andre, but his anesthesiologist.
How do you sedate a man who's 500 pounds? Jim Troy, who was a friend of Andre, was there when he had the operation, and the anesthesiologist would come over and say, well, give me some idea. How much of this should I give him? The only thing they could possibly equate it to was Andre's consumption of alcohol. And Andre said, well, it takes 2 quarts, 2 liters of vodka for me to get a buzz on. And they couldn't believe that, and Jimmy Troy confirmed him. That'd be about right. Although I've seen it happen with a bottle and a half, But so in essence, that was the trickiest part of the entire operation was the anesthesiologist. You can't give him too much, you kill him. If you don't give him enough, he's going to wake up. And that won't be nice to wake up an angry giant when you have his back laid open.
The operation was termed a success, but to those who observed...
Okay, so basically they use the fact that alcohol shows cross-tolerance with anesthetics to try to estimate the amount of anesthesia to give Andre the Giant, which is a really interesting use of the idea of cross-tolerance. So drugs, again, that have similar mechanisms of action can show some cross-tolerance. Barbiturates and benzodiazepines can show some cross-tolerance. There can also be reverse tolerance, which is also known as sensitization. This is less common and it's only for a few effects of some drugs. But this is basically that the more that you're exposed to a drug, the greater the impact. So we see this with cocaine and motor tremors and seizures, so that the first time someone does cocaine, they're not nearly as likely to have motor tremors or seizures as the 10th time. The more they do the drug, the greater the likelihood is that they'll have that effect. And that is the end of this chapter.